The team from prison contact the parents or the guardians. They bring the documents. Once they bring the documents, then registration officials come. They come, and then they are able to identify that applicant. The registrars are trained in a way that when talking to the applicant, they know this one is a Kenyan and this one is not a Kenyan. But what we have found out here, we didn't get any new application, but we have gotten 102 prisoners who have lost their ID cards, and we have replaced them. Yes, I think the PS will tell us.
Have now SHA here with us. Our inmates are going to be registered, and it will save us a lot.
For us to be able to register with the SHA, the challenge that we are encountering at the moment is lack of inmates having identity cards. And we are glad that the PS immigration is here today. And we were taken through when we first came in. And the PS will be able to address this issue. And we have no doubt that provisions will be given to ensure that none of the inmates in the Kenya penal institutions today will lack that opportunity to be registered. I want to thank all of us, and I want to challenge every officer, our families, and even the inmates who are in custody to ensure that we register with the SHA. That product is good so that we can be able to access health services everywhere without officers in charges being required to pay for the inmates whenever they go to hospitals to receive treatment.
And that's why we are here today, to ensure that the identity of all of us is appreciated. And that's why we are here to launch these identification processes for all our remandees, for all our prisoners, because we would want to maintain our identity as a country, and our identity as citizens, and our identity as humanity. And that is why all the IDs that may have been lost, any one of us who may not have registered, we are here to do that today.
We are talking about SHA today. And SHA is an initiative that ensures that all of us access equitable, quality medical services that we need, when we need, and where we need. You see, we are speaking here today in Langata Women's Prison, and we are saying you are supposed to get the right or the quality medical services you need, even when you are here. And remember, especially as me as a mother, I'm really praying for you that God will open a way, you clear your terms, and then you go home, and then you go and change the community back there, because I'm sure you've learned a lot here. So saying, we thank His Excellency the President for being mindful of all of us, of all Kenyans, to ensure that we are able to access medical services.
We are very keen to ensure that we achieve universal health coverage. The Kenya Demographic Health Survey of 2022 put only 28% of Kenyans as having any form of insurance. Any form of insurance, and this included 26% that was in the National Health Insurance Fund, now defunct, and 2.7% that was in the private insurance.
The private insurance has stagnated, is still 2.7%. And it is important that then the government has to take an initiative to assure the health of Kenyans. And that is why healthcare has been a key pillar of the bottom-up economic transformation agenda. And in that pillar, we have 4 key results areas. One of them is health financing, so that every single Kenyan is assured that they will be protected from what we call expenditure that harms them. And that is people who are selling their land, people who are selling their cows, people who are selling their assets, so that then they go into poverty because of healthcare. Part of the special groups are our citizens in lawful custody, our guests of the state, who we are also ensuring that we register.
It is indeed pleasant to join you today for this momentous occasion, the official launch of the Social Health Authority Registration Initiative here at Langata Women Maximum Security Prison. We gather here this afternoon to affirm the principle that lies at the heart of any just society, that human dignity must never be compromised. Why is this? Because every human being made in the image and likeness of God is sacred, is a soul. From womb to tomb, every human being is sacred. And this includes even every person, even those serving custodial sentences. They are entitled to healthcare, to compassion, and to opportunity for rehabilitation and reintegration. This principle is enshrined in the United Nations Standard Minimum Rules for Treatment of Prisoners, commonly known as the Nelson Mandela Rules. These rules remind us that all prisoners shall be treated with respect due to their inherent dignity and value as human beings. Prisoners should enjoy the same standards of healthcare that are available to the community. Ladies and gentlemen, since the initial rollout of SHA in November 2024, our officers have been working across the counties to register inmates into the universal healthcare system, which is one of the pillars of the bottom-up economic transformation agenda plan. This has been a pivotal step in delivering the promise of healthcare for all, a promise that includes those behind bars. This initiative is a game changer, and it's an equalizer for every Kenyan because we save lives. And for example, like the PS Medical Services pointed out, you do not need to carry a card. But if you get sick anywhere at all, and perhaps you have a terminal illness, and you collapse and you're unconscious, those who take you to the hospital, once they take out your ID card and the number is inserted, anybody at all, the medical officer will be able to know what disease you're suffering from. That is a game changer. That is compassion by His Excellency the President.